Some choices are obvious. This applies to vaccination. The choice is obvious between disease and health. Vaccination, the obvious choice.
Following the success of regional vaccination weeks in the Americas and Europe, I am pleased to announce that this year marks the inauguration of the vaccination week in the Eastern Mediterranean region. This initiative has been made possible by the strong commitment from countries in our region to raise awareness, increase vaccine utilization, mobilize resources, and secure strong political support for immunization services.
All countries decided to make history by participating and contributing substantially to this event, despite many challenges, including time constraints and limited financial and human resources. Vaccination Week 2010 exceeded all expectations. It was extremely successful by all standards. 100% of countries in our region participated in this historic event. All countries had one common goal: to promote and celebrate immunization. Importance of vaccination was reinforced through advocacy, education, and communication. Parents, grandparents, children, health workers, stakeholders, policymakers, celebrities all contributed to communicating the value of immunization. Hundreds of media outlets, newspapers, internet, television channels covered this event. Millions were vaccinated through outreach, mobile, and campaign activities. Let us reflect on this successful story. Preparation of this week is an example of true partnership, collective and collaborative efforts of all WHO teams, together with ministries of health and our national and international partners. Our key messages relating to young and old, disease and health, everyone's responsibility and investment in better life, reminded everyone that immunization remains one of the most effective public health tools at our disposal. WHO, ministries of health and partners were racing against time. Quite impressively, almost all countries formed national planning committees, adapted promotional materials, submitted plans of action, and engaged with the communities and stakeholders. Countries formally accepting to participate in this event increased on a weekly basis. The regional celebration and launching ceremony took place in Lebanon under the patronage of Her Excellency Mrs. Wafa Michel Suleiman, Lebanon's First Lady.
يسعدني أن أضع يدي في يد القيمين على هذه الحملة التي تشكل أملاً متجدداً لأبنائنا بالصحة والعزم والطموح.
All countries organized and launched celebrations with high-level dignitaries, celebrities, and impressive media presence.
والصحة وحدها هي التي تزرع ابتسامة الرضا على وجه الطفل واللقاح خير ضمان لذلك.
Media and advocacy materials such as television spots, posters, banners, roll-ups and pamphlets were produced in most countries. Seminars, trainings, workshops, lectures were conducted by most countries. With hard work and dedication, innovative ideas and solid planning, even in places working under the most difficult conditions, witnessed successful celebrations and promotion of immunization, and millions of people were vaccinated. Almost all countries have shown evidence of extensive media coverage through print and electronic outlets, elevating the immunization profile, sensitizing the policymakers and stakeholders, raising community awareness and demand. Undoubtedly, millions more people in our region have higher awareness and appreciation of immunization through these heroic efforts.
In spite of all efforts, an estimated 2 million people in our region were unvaccinated in the year 2009. Reaching these vulnerable populations, typically living in poorly served remote areas, deprived urban settings, and in war-torn states, is one of our biggest challenges.
Vaccination Week is an advocacy framework. Protecting more people, expanding beyond infancy, integrating and working in an interdependent world, and introducing new vaccine remain our focus.
Increased costs of introducing new vaccines into national immunization programs will require additional financial commitment from donors, partners, and even middle-income countries. Therefore, innovative mechanisms to mobilize resources are urgently needed to assist the countries.
Because our dreams and ambitions are great, we should learn from the lessons and continue to sustain and build on our success. The success of this event, the fact that it reached beyond expectations, poses a risk of complacency. In 2011, our aim should be to further expand our partnership for immunization and win the hearts and minds of communities, the media, and leaders.
Let us use the first vaccination week in the Eastern Mediterranean region as an opportunity to revive political commitment and increase public awareness on the importance of immunization. It is my firm belief that our continued collaboration will make this initiative a success. Remember, vaccination is a family and community responsibility, and vaccination is the obvious choice.